6, 5, 8, 8. So pin that comment. Just bear with me, I'm trying to share this. Okay, so Assalamu alaikum. Just waiting for a few more people, especially my guests, so we can start. Let me know if you can hear me. Baling ni ba jiberola please. Alat jang no mobile auto ngalo. Okay. Assalamu alaikum, assalamu alaikum. Just bear with me, just waiting for Mbaling. Once I see her on the screen, I'll put her on, add her to this call, and we can start the conversation. Thank you so much for joining us. Bajibe Kane, who I could add. So Mbaling is writing to me. Let me just make a quick call. So yeah, digest news nying ni tata water. Amantarante fangola page water, so ni be digest news. Because mba telephone o me use kan yin telephone doto ma wala tina. So nte fangota ma share no nte fangola page water because mbe digest news. But in yake mba tunga page o nying la name sene then ya sen ni dunta water. Mba okay clean exactly, yeah. Okay. Let's just try this one. Thank you. Please forgive me, bear with me. Abe matry ka neka modole dundi nang balik. Ajibe. I think we're struggling a little bit. So mbatong baling tag yang. Baling jam. I'm here, okay. Let's see if I'm gonna see you. So mbaling ye option soto le bang bayri benje kan ye option soto ila screen auto je le bang green one or puruka request send nam puruka join to this call. Woji beba for ye feng soto le green button member for le ko join this call. Exactly, great, well done. Assalamu alaikum, Gambia. Yay, mbaling you worked it out. Yeah, work out le.
Yeah.
Thank you. Your Mbutunga that is
Ngato.
yeah, thank you so much everybody for joining us. Welcome to the Digest News.
But your voice is echoing.
Abe echo kan. Saya benyadi iba jibe kan device full out of four. Is it just the one device?
Only one.
Only one. How is it now? Abe echo kan hani before? Can everybody else hear me? Atol men be jibe rola. Let me know for alkam moila bang. Mbaling echo ring be only hani side. I am here
Yes.
too.
Okay. Akela words or a repeat.
Oh dear, that's not good.
Yeah.
So how did you I told men be jibe rola the other can you guys hear me at all? Am I still echoing? Yes, they said yes. Gosh. That is not good.
Yeah.
Facebook is so messy.
Yeah, Facebook is just.
It's very messy. For because of page on near call we might
It's
have
still repeating your word. I don't know why.
It's repeating it, yeah. Because that's difficult. It sounds okay to me. So some people it's okay to them, but some people, yeah, are fine from my end. Yes, I can hear you. So it looks like it's some people are sending it to go on is fine. Okay. So maybe ninga kachanying continue. Yes, we can hear you very clearly. So akitalako maybe it's few devices malong for and it for device killing them my brain give a water. Yeah, I don't know. But in Quaker Moile, yeah?
Yeah.
Yeah, I'm sorry about that because Malong, I don't know how to figure it out on here, but in model code they can hear us. Maybe let me
ring off and join again and see.
Maybe, yeah, try that and see. Yeah, just try that and see. Maybe it drop out, you join again. Okay. Sorry about that. We're trying to sort out the technical aspect. So welcome and thank you so much for joining us. If there is any issue with my voice, please let me know. If there is any echoing, let me know. But we are out here again today to talk about maternal mortality. Of course, this is not a new topic. It's trending right now, sadly. With me today would be Mbaling Cham from the Gambian Women's Lives Matter. She's the founder of or co-founder of that charity. Later on, when I finish with Mbaling, I'll be talking to Hadi Juf as well, who is a representative from the midwives and mothers, who would also talk to us about their own experience in their charity. So really, today's talk is more about hearing it from those who are on the ground, basically, because some of you may have already seen or heard the audio circulating or video on social media where Dr. Samate was castigating some of these women's rights activists, particularly the Gambian Women's Lives Matter. He basically is denying that maternal mortality is on the rise. But of course, this conversation is not basically on statistics or the numbers. What we are concerned about is the causes of death. Why are women dying basically in the rate and in the manner that they die? That is the concern of most of us activists, actually. And I think it's important if we hear it from people that are working with victims and their families, and also to find ways of collaborating, ways of working together as a team, because there are lots of small groups doing amazing job in the Gambia, but we feel that there should be more complementary work on the ground than we have right now. So without wasting any time, I'm gonna add Mbaling on this call again. We get into the conversation as Mbaling.
Yeah.
Abenyadi lesai. Oh, great. Well done. Okay, nge bismillah darong digest news to jang nga content ko soto baake pour ke soto on here ngal ko you are very busy ibe interview ol ke kan here and there bari ngamira ko akumaya ta baake pour nge soto nyim platform oto nga kacha soto me alon ko abe dending maternal mortality ko to membe Gambia ni watol kono diamo siata accusation jamal fintitanang Gambian women's life matter fa wala karola andung tol be musol la nyantole kele kan banta jang momo yen na kolong yalon kon ka wala kele nata audio moy from Dr. Samate me alon ka en ni okuya bake lafta nga kachake mala sisako kachake just based on political la karola or Dr. Samate la karola bari pour que la ite fangola Gambian women's life mata fangola do ko fango jibe albe impact men ke kan Gambia kono ani molbe support ko no la nyame ngamira wala fango munna wala fango yatin na wulita bari ninyin accusation si fal findita bari atol mu charity lati bari to ko ya ko len andu molla ko dole ka dunje abe bete ya la ko nga sene yandi roke badi wala men ya lon ko jibe ro la wala ke la ko do dunde nyin ko kono wala bala fa fango soto Gambian women's life matae ya long kolbe nyame so ni koko nyimmo politique group bolti abe kuma yalan mo men kala kodo dundije ay senea mako hani nyinte woti nyenam wala actually wala so wala nange invite jangdi nye bula durong ye molu kontong de nana dum kacha kono nga few questions sotore be nyinin kala menno bismillah
Thank you so much for ikamin beke fanang biring women's life matufong la starting yela bes be try le nyanta min beke la wala nam visita nyawnya yen kumandi nyem platform to nata because amanke ko you are fighting for only Gambian women you are fighting for a lot of stuff if anybody follow you I say time I know I'm at work I have to call in and talk to you because what you are doing how very important it is so I am super and my daughter Matilda always like you.
Oh, thank you.
Yes, it did. I busy but it can join Nigeria. So we really appreciate everything you are doing for Gambia because we are all doing the same thing. But you guys have been doing for a long time. But Gambian will be definitely what is going on. Amanjara nga diam jamako. Finti tamen kama wolo nyentiko. We believe that no woman deserves to die childbirth. I've been traveling for over 20 years. I never heard of even any of my co-workers die childbirth or an old father. So it's like, why Gambia? He came here, he can see why Gambia? If it is like 10 people a year, it is I understand because the environment is different. But for them, they are talking about even 433, 400 and something a year. To me, why are they mad about that? Ni tolko ila fen kolesiata even before 2021, whatever 2000. So when they saw me those things, I'm like, okay, why be daring work? Because my 19-year-old child, me along is always interesting to be a doctor. I tell you, I'm going to my auntie died, so go call yalong child bad because in the family and kafulanding ulu bakele. I fulanding all start ke ulu. I feel ulu Sikota Health Center, and they send her with another one to the hospital. Moto kono apart the ambulance because the traffic was crazy.
Yes, sir.
So my kid always see me talking to her, and then my own sister too. So this is personal to our family. Then my own friend too. So Matilda is like, but why this is happening there? Because in the training to be a doctor. Then I book a family. Then I was a child bad death. I don't know. I Gambia to okay no lokuja. So we didn't get Gambia because she never go to Gambia. I didn't know she's busy too. We have to go together. But the only thing, if you can connect me to the hospitals. Because niya tatala European katana intensive civil, but I will do it Gambia. So the point that I need Dr. Soul contact connect RVTS. They are very wonderful people. They like her a lot.
Yes, sir.
But yano jandino only minje kafula. Ate biring atata wulu bungo nyum follow kono. akoy bari jamba kandirine akoy ko jambe kandirin bakele moma nyana wulula ikay ko fete de mandingol jantol be nyina ko na koy no you are having your operation jacket and everything, you know, this is very warm. And the ning can do the caring from it. In general, if somebody have some complication, it will be difficult for you to manage it because can do mean the caring from the way I see you. So I but then from kende so not akunya mama, I know why people are dying. Akunya these people, they don't have any standby blood. They don't have anything. Even if somebody have cardiac arrest, akunya sometimes all this could happen near mobile or mapurka munu. Akunya but even some of the doctors, I am better than them. Which school did they go to? I was thinking she's joking. And she went back to Sukuta Health Center. The same thing. I hope it all gets you know what? Gambia government, they are playing people life. Because why I say that, you know, there is no medicine. We have to write it for people after this operation to ask them to go and buy the medicine. Those people are in pain waiting for the medicine. And the bathrooms are very, very, very dirty. You know what? Why their death certificate we are putting pneumonia there? That is very bad infection. Me alone come remember I must no so me benjibe cafe alone nante OBGY doctor. I don't know anything about that side. So this is how, but she already have a foundation called Mbama Care Foundation. Martin Luther King said, sometimes if you make a noise, people will hear you. We are going to make a noise.
Absolutely.
So that, but good thing is, before we come back from there, she register to the logo Gambia Women's Life Matter, which people don't know. She registered since 2019. So we come back to US. She want me to start with, you know what? When Jaliba seeing you, I have enough insult on my head. I'm not going to involve with this. So anyway, COVID why are you scared of what people are going to say? Why can't you just be yourself? So this girl, she's very, very interested about this thing. And then she applied the 501c for Women's Life Matter here too. She got it. Now I just want to be in the hospital for only women. Definitely, because she's going to pharmacy's medical school to be only the emergency surgery. I think she's working hard. I think I need to help her. That's how I involved.
Right. So basically,
and it went well because the day she put Gambia Women's Life Matter, it's like everybody know that it's true. Our life matters.
Absolutely. I think ninga mo molka foko women activists or lay na feminists or it's not about feminism or women's activism. Nyimu is everybody's business. Mobile hajo munyinte because it's about our mother's life. So ngadung kacha kono proper data la site nyinto bari ko from 2020 to 2021 September aliye more than 200 women register many along ko banta in childbirth. So figure nying 204 lembang for 207.
207 right now.
207 lem ha. So 207 yim andung aliye wol register nyadile aliye birth certificate or le soto bang aliye data nying collect nyadile.
No, because you know, when you doing something like this, it's like number one, the nurses are not going to be happy with you. The doctors are not going to be happy with you. The government will not be happy with you. Because why? Some of the negligence is coming from the nurses side. Experience. Ni momo be tonya fala no solibente no su kende bali bijela nte ka wofala wato I say this Maimuna something in Jemme Foundation. She is amazing person. She is amazing. Tafanka mold fenkelen kafwe kunko. Alta nale Maimuna ngine ta konta la tintinali ya trajari ya mbali ni indirect because ngajele mbelori amalon konta mujemalati ngala do kujela. She was having 4% when yalan kenyanta wulula. But ni na ta ka jele la ye bulo muta. Ani e tartulu la fwe kunko. See, you are going to be fine. You know, it's not like ite tato school. You are doctor, you know, even the language. If ite ala no ko jang, if you are a healthcare worker, even caregiver. We have a date I have to go and pronounce it because I do hospice. But even the caregivers cannot pronounce it until I get there. So it all will understand.
Right.
Even more from Fatih no so bulokoro. What whoever there itata pronounce la for ila no so me along ko wala mala do koti and the case workers and whatever they confirm this person is there. You cannot just give the family that information, but we already know she's dead. But why are we doing that? Because more yela dulala so more yela paraso so they nyata dita.
So
Gambia
no so leka nombal dialla no so leka fale fu victim ol fa wala family leka ko mandi ka fale ni mo
no ndol ka min kani en komandi ko nyako we have a lot of nurses nim min ka do ko right, but most likely din family member yon contact ko na muso banta sai nga fay ko oh we are very sorry ndol we are fighting for this and I am very sorry you are one of the victims. So nga fay ko lafte calm down yalong ko ini anything and some people will be on the phone with us ila frail dead body welaring ye kumbo we have a team. In fact, we can connect the near the officer. Can you please also have the death certificate so that we can post it because we cannot post it without the death certificate. This is very serious matter. It's happening. Oh, no problem. They can take the picture of the dead body and send it to me. I can see any few of them. That's the time you will know that this is a very serious organization. Because you know, even somebody needs blood. I want to make sure definitely this person needs blood. I will not just post it like that because there is a special people many along they will call the number because they don't have nothing to do. They just want to make sure what Women's Life Matter is saying is true.
To just
but thank God.
So ngamira wasane atale so you guys are not just fabricating the numbers more like Monday and ali death certificate or sotole and I think ali you mentioned fangoka some sort of snapshot the molla kaita the molla the gravity of maternal mortality benya parce ngamira ali menu be 207 membe report njikita ko wolbe they are pregnancy related maternal deaths. So kono maya kono wala wulu kono wala just after kabiri wulu talemi fata. So those are actually pregnancy related. Amanke ko accident wala soto wala ikele bute wala violence or anything like that. So ni nata ato lower data from wajibe mbaling yena Gambia Bureau of Statistics will ye data membonding in 2019-2021 akatala ko itolle from what asiata atoli memfo. So which actually then shows that this is a really bigger problem. So health professional or Dr. Samati and health professional dojo wako maternal mortality abitalakani. Those are false because honey Bureau of Statistics ye memfo ko mota fono la kabe talakani because of data nying benyaming ye men compare in 2013 and in sign amanke killing but honey if we go by your data actually a sort of thing ngaloneko is on the rise. So you know is falsifying amanke kuti me alonka nyanta puruka information or this community la wala society la me alonka among sort of just because ilafta kaitandileko you were doing well at that sector. Saying a move on ngamira ka be kuma ya lambali kuru ye feedback di la timo la come maybe ila demanding and wider timo nying is a report that anole me alonka se publish nole even as a doko kenole with the Gambia Bureau of Statistics kanying number jibe kuke ka report the cause of death la because lafta ka do motole mine ka nyim molu fa because you are working directly with the victims abe kuma la moli along ya moite famole ite ya mira ko mune ka nyim mol majority of them mine ke fa ye negligence for janne and infection but it ni family ni mene kachate ila mol ka mine foye ko wala ya tinna ko ika mol ila mol ka fa tingoto
nyim point nyim ko maya to back because many of them is like blood loss, which is hemorrhage. It's very common. Even here, we have it here too. Muso dol bigeni will take a blood loss, but because of Mbuka Kalamta, they always have standby blood and thousands of doctors in front of them. So nyemu fenity is common for muso dolu ya soto. So mo juma bigi, since I've almost 60% of them, ntolong aminu long. Ibe ko problem le sort of bleeding. So but the problem is ntolle jang ni mo wuluta. Before they release them going home, they want to know how many parts are you changing because wole katandi ko yele nang kam jella ka bondi ni mari baloban. But Gambia that's not the case. Many of them tolunga date min financial to mo jama bije special birikama. It only wuluta musol wuluta less than 6 hours they are sending them home. So that's a big problem. I even write it to the minister. There should be a policy.
Yeah.
Refer these other people to another hospital because the doctor will need more. Me along to coming for I have their voice message. I will send some of them for you. It's coming for you to go. Sister Jambe overflowed in it, so we cannot keep them. So I asked them, why can't you refer them? People who just came, refer them to another hospital and make so before you send these people at home, they are okay to go at home because ni woli taka suwo kono ika believe le nyali e mini ye start ka realize ko yelo le be bodni kambala sometimes buka fta loptano fa te fa wo siyata ntolla mol kono bakel fa me min fata siyata je bakel so wala nanga fo ko is very very important for us to work together. Because I told them to refer them to another hospital. More who told me nata. Before you attend them, there is not enough bed. But don't send these people at home because they say, for example, Banjununi Hospital, this girl have a triples, and her name is Adama. So she delivered them after same less than 12 hours. Can you imagine if somebody me didn't sabale wulu there, those babies are premature baby. Ya fa ko ni taka suokono kana son fonyo yema ye morom ye bunda so mol kana dika. Mommy a triple soul wulu because jawo from they will never let you have triples for natural delivery. So after that ataka suokono aka ke mike barinte nyaka minina de nyaka mininda andu yellow minka bondi mbala Seattle. They went back to this Banjununi hospital. Trust me. Ya fo ko jallara ngol fatala ntol tamutan wala jeng. This is normal I ta suko. Akema amurunde suko na kai te ni man sambalop tani be fala. Then the husband rose out to the canopy. Did you put the canopy? The lady give her the wrong blood.
God.
Blood me alone, but that's not her blood group number. We have all the documents for this. I came up from ya following the press conference.
Wrong blood.
So this is very young girl, very beautiful young girl.
Imam blood yin gibe fo?
Ito mean ke wala mnyiti ko ikon tele ko she is B plus. That time she was A negative. So until la fanga yo blood deep, I still feel guilty for that. Nitaka mo nga sa Facebook somebody call us ako umbita kan kanifing. Atata yellow fenki ya yar fate wrong blood la kontoli. So video odi dong ala body be change taka blue according to her husband because atemu mo koyalty. The body start changing. Then ya rose banjun. The doctor say who give this girl blood? Ali yellow mean wrong yellow.
So womo incompetence leti. So womo healthcare professional.
Yeah.
And in long bali afong bigi and people like that should not be more of a call. People like that maybe Danny Roke la menu be call ke nye but mfoning bali nye question and answer nye question on him but then na left a call ke please. So for this caller who is calling. So more manyanaka employed na lopitano to more long for imam qualification of to
Thank you.
because things like blood it among more blood type long no it wrong blood the wala obviously what Mary Meng responsibility for that should have been accountable for that because what Mary
Thank you. But because he's family with Dr. Samate, so everything still now I can give you that family number. It hurt them. Those kids are growing. Government is giving them nothing. We even Seiture. Seiture is paying some of their hospital bills. Safe and involved to Okona.
So
that's why I just look at them and because why number one, if you are standing talking about this maternity gate, I think the first thing you should say that sorry, you have a family in here, because but I don't know how I will go without my mom, especially those little ones. I am very sorry this has happened to Gambia, but I promise you guys we are going to have better health care for you people. Instead of saying that blaming the victims, that's a very sad Gambia how people are treating people down there. These victims' family need the answer. Because he told me I don't know when you met a kill of course until the Facebook also, but it's something been happening for a long time. We all know that. But Nitela Motimi Arango, more Jikita Koitela Gambia Bill and Minister of Health. Tell them we will make sure we investigate each individual date. New men's like mother case is pure negligence. We will promise you guys we will investigate and we will follow some of their policy they are acting. I think together we can improve our healthcare. And another thing is no solely the environment they are working. I cannot even work there. I give credit to them.
Yeah.
No, if I do, I do ning ala ning kila teba. They deserve better.
Some of them.
Inyanta loan sotola mi alon ko ibe function ko dal sotola. Inyanta man sakunda inyanta jiberi bakele la kula. Ila doku ko la yatal. Ila doku ko la yatal bake la because they are overusing them.
Yeah. It also they are under resourced. No so man.
Bima wo program o jiwe mi be care on lumbi.
Can you imagine?
It's a very interesting. Oh, Yami found this one here. You can watch it now in YouTube. They all come out. Iko mol bi jurmari nyokan, mo sabal belaran killing kan, mo fula belaran killing kan. Today that was going on. Iko it all their tired.
Iman capacity, so that's
should not
one
come
of
there.
the things. What triplets or many along ko abama ni musoni abula la seta because iman capacity so to iman larang so to purko ma so those are the things may along ka manya nakake Gambia right now. We are giving COVID jamano kodo men pumped into the healthcare system. I am a grand soul di molale. We have those documents. Figures all be mol bulle. $21 million. Yo okay healthcare system okono Gambia be doya rinyaming tech. We should have a very slick healthcare system. Into the
because I know it true when I'm doing this. When I'm PR or Yankomandi, ila musol ning kiela fe control we say in a group also they want to donate the blood. We don't want blood loss to kill anybody in Gambia. Make sure give them the blood, stand by blood. Ikonya koyalo itemala mimbe kere konya your husband even donate $1 million. Why is the money? I'm
because accountability. Accountability.
I believe them. Ikonya there is no fridge in the yellow marble janyami. And I believe them when I go to Toyana, if the new maternity ward of Bangan Hospital, Darabo Bantaraji. So those infection will like a new sound, more people are in your can near you. Ibuka believe. In Tata Gilan from ya. Darabo TJ, Annie B, Lara Winka Musol Casidi without no beds.
Yeah. And so Bambandino, because 2020 in the Gambia, Jenny COVID Besira, Benung placement la in Women's Bureau la Brikama, but in a colleague do BJ, your place in Brikama Hospital. Where Natal sending telale, we didn't bring it out on social media because Doko and Tata no one like me. But near Walla Larangolje, Anila Musolka Wulu Damengland yin today. Walla Larangol sponchol ning like wet sponges, was sponchol baby sinang din pucha, dul bije men bije ibuka for ham so obviously for most infection also to natural for even general hygiene, Ubuka Keno Lokanoto. So these are out there. I'm making many along make up because for me, there's nothing to gain. I'm on politics touching la konga.
If like the Sajava jokes some of the givers a break. Facebook. It's not like we are not putting their pictures on the Facebook. It's on our page. Sometimes 4 or 5 people a day if you see it all the time. So because rest in peace, somebody will come and say, my lovely sister, my this. So ni andong Gambian of any more kamulu. Near more Facebook, Mimaki Gambian oti, Mol Bahalonale. So let interview for Dr. Samate will into Dr. Samate. Ite alone eating alanin kila tema. Imam fenne ke banko kan nanata health sector la site la. And I think he has that guilty that somebody come of mol group or nata organization or nata mini along ko ibelori ka mol makoy.
And then
because for example,
challenge le fanganala ministry.
Yeah. For example, you know nangana for majority of them kamano yung alamuso banta. Bira banta around 2 a.m. in the morning. Yeah, five so many body come less than 3 hours old baby. Yeah, dear. Ikai ko ila di na no fer.
At that night, one of the things that you left them malanun din anon ye kadile straight away la
kadila right away. So asita duma akumbo to we were on the phone with him. Ako abita didn't of fail because ataman sunju soto. amen fen so tata dinne ngomuta nol nga fay no nga fay mbuto ko no so dia nga fay ko nyim be dami you cannot even give the baby to him because number one there is a blood. You people want him to pay $5,000 to get that blood, but she don't have the money to buy blood. He among ko do so pur ka yellow nyinsa.
But if yellow
ko yellow biya
but
wandi talo.
Yellow bukasan. Why yellow nyanta sana?
Ika wafule. Wala na all these people volunteering blood down there. Wala nang ko ni no solo ka ko dikendo so that will not happen in our health sector. That's why they need to pay them good money.
Yeah.
This is corruption, pure corruption. If ngatonya fon.
Yeah.
Na banko nying min bije nim mol man finti ngatonya fo ntol ni no solo wo atol min be katara midio wallahi femanta improve la. Mbe muru na ko male dron. So I am lucky, you are lucky, but our sisters are there, our families are there. So you know problem with it. So what is the point of me sitting on the TV? Because in family, many people know Bali Jam. I don't think I will have any fame more than the fame I have been having. So we are not doing it for fame. We are not doing it for anything. We are just doing it to help our people because their life matters. Not even only the Gambian women. Gambian people's life matters. Why I'm saying that? Ikanyin wol take juruma nyoka. Ikanyin patient tol take juruma nyoka. Nyin COVID time. Niye je fanga ka kumbole mole katara juruma ri nyoka. For 55 years. I think we can do better than now we have right now.
Absolutely.
Yeah.
Absolutely. So it will be for political Gambian women's life matter. Because as I said in the beginning, Nimobe Bankudoku wala be charity like everybody has the right to belong to a certain political party, but as a group, Ngamirako Mojamal Benafirako Alieke group Timealonko is a political. So akana support it and they wala la for it and to a particular political party because wala fana don't encourage puriye mako iroke. So wala fa lafta katine o dula fana sene and isaji ko molye faham roke ko because atebe political la we could see that because atebe no political platform le abo fokan andunga moy fana ko ateda mante ko Fatmata Jawara fana dia
Fatmata Jawara ha
so mate tamoy definitely bari ngamo ile ko ika idea mo fele brikama abe
ngonta jimbe phone wala
jang because it's becoming like a fight between government and in agency charity many along ko itol ba try kan ka government la efforts or complement but isa kitala ko kelole bekeri nyun ko kono and I think that's what we're trying to bridge pulling in kana ke kom keloti ike joint effort rather than ike keloti so wodu lato sani andi bangay men for ko political atol ba wala ni mu political group leti iteka men for wal mang soto jedu la sani andi mole
ha nyin dula ku mayata bake ntefa nyin dula kala filango sene andi kende because why Dr. Gambia no Lonko. Gambia Women's Life Matter have their own page. I have my own page. Nita Bali Cham, any Women's Life Matter is different. I want people to understand that. I'm a human being like Fatu. It's an individual kuokele. Ye came out post, but you will never see my husband in Gambian Women's Life Matter page. You will never see my child there. So sometimes people mix and I want them to understand in the United States when you register your organization you are not belong to any political party. Woman can lotija.
Right.
Impossible. You cannot be involved with any political party. It all misunderstand and all these government people right now even because this is something I be Gambian ol kurandine to see people dying every day. Not even only the Gambian women. People are going to people's house, killing them in the street. That's not the Gambia we know of.
Yeah.
One another month na Gambia. Funding kele tarata mala mole nyepaka ye bute ye fa. Mole ta mole bumpone dindi mo rape ji. Mole more rape ke balolu bonde ka kuwole ke. That's the new Gambia. Alinga tonya fon. Na bankoti tano la without we telling the truth.
Yeah.
So if you voice those things out, you are enemy, you are anti-government.
Yeah.
Because in me personally, Ami Bojansis reach out to me when I was in Gambia.
Right.
Because they know that contact of fengo bele fit in I have funny ko alaftanin first lady nyomai. Sending for no problem. And she called me right away.
Okay. First
But
lady
all
niya.
what she
First
wants,
lady niya call.
yeah,
Okay.
ala ko to niya, ala practical o yung call nato. They're very nice people, but nobody gonna buy me because they don't even know who they're talking to. Me, I know all the GM people are trying to. I'm not gonna accept those things from the government, and then our poor people are dying at the hospital. If
engagement.
anima for mo yenye offer direct, but ni ko mo ko ninga $20,000 dollar delay si the Facebook iko biyo iko mbali chambe MPP le dulabe tailor.
Oh wow.
What did that mean?
Yeah, that's the form of bribery.
Or tell your people to come inside here. Why? Man buguma yo so posé dara nit su déxé yo xam nga man suma posé dara si yefi lankonté sa jëkër bi nit ñi ñëw saaga sa jëkër daf la né.
Gosh.
So yo tam so posé dara nit ñi ñëw saaga comme ni ta fa nga fen sa fe na Facebook or somebody die, people are coming to insult Barrow government. So ate wala mala consent wala mala miro.
Quiet in the kede in the purika.
Let me tell you, ibuka mo quiet in the dama, but all these people who are insulting people is from that place. Because in Tangano.
Wow. That's interesting.
But also can tabulu koti. Alhamdulillah Rabbi Albinambi Jambuka Fenso to Barin Canada Mandingo Soto. Poor people will be falaji. Not only them, but for us, this is helping our even the healthcare workers knowing that somebody is watching them now.
Right.
If something goes wrong, because you told me meeting some of them even are you guys should stop using TikTok, Snapchat. This Mbaling is writing everything up, it goes wrong in the Facebook. So that means that the improvement is coming.
Yeah.
Before they don't know, nobody's watching them, but now they know that every eye is on them.
Yeah.
So I think the government should be happy about that because sometimes our nurses too. To me, along a very young girl, ala sister-in-law because I'm on futu. Wala kaya ko I'm on follow tell let's go to the hospital. Ala classmates ya kaya ko. You can you say bring a bill? Everybody was sitting there.
Yes,
so I have ala nye kaya ko matong ta gisu masangam ni. Afiti ta aya ko la kaya ko nana anata kaya ko mo bi benjibe kan. Mo bi benjibe kan. She never go to hospital until she die at home. She give birth.
Because confidentiality fenti no privacy.
Absolutely. So kafako ngano si yele formula dung. And if sorry, I know the nurses are watching me.
Yeah.
If you see these people at the hospital, some of them, they don't even open their mouth and talk to their patient. But me and million do one. Nah, def nyawal, puro wari nyawal. Nana, ila shenkele kunu nyimbi jande. Those poor people have been waiting for 6-7 hours. And because of them, that's why you are having salary, you are getting pay. Ni mo batala suwo ko na nato lopitano to. Ati amira ke telam alati. Because I ajelo ko ite bajaral. But going to that hospital, you get ikasasa means to ji. No, they don't know. But those hospitals, if you see the maternity ward, Banjun Hospital la Jonkonkon. Woka mol bam falo le.
No video nyingjele. It's appalling. Yeah. It's disgusting. So yalo will be kafuko ha minister te nyimbeke no la wala barote nyimbeke no la bari leadership le ngobeti because mo bijele mem marata lopitano la jonkon la puruka je kwa isenia. So nite ya jeko in fact social media is helping because maybe it also many besanto ibuka nyinku dol kalamota. So near nying sivalje you need to do a follow up ya investigate ya jibe munati na nyindon ko be nying halalota wala muna na lopitano mandara boso to natala ko ite wo provide already. But if Gambia, it looks like mobukala doko kijeto. It's like people get up, go to work, just put your day in pass dorong 9 to 4, 9 to 5, you say. That's it.
Sorry to interrupt you. I remember we have one of the cases that day, like 3-4 people died. And I reached out to Banjuna, what is going on? No, they are going to work at the private hospital. It's Sunday. They leave like 3 hours before they are supposed to be done. So only one person was on that ward. Is it fair? No. It's not even fair to the nurse who is only one person working in that place. But near the university, with 2-3 jobs different hospitals.
Yeah.
They are not getting the pay they deserve.
Yeah.
They are not those patients to one person.
Iba moy kanne malon fon na call
Hanta be moy
iba
kan.
moy kanne okay fine because molen call ngama mol men yen na number so tay ban call kanne directly on my number so please nga number ben pin call that one when baling is ready I'll say call keno wotol but right now fon se nying labang so baling nga dung ining yet demanding for the first lady in ala engagement no but ministry fango inene reach out tale to them bang wala foi to reach out tale to ita bang pour ka jibe albe do ko keno la nyadi because Dr. Samate ngala video do la moy ate ko atol man reach out al na manan naka ministry nyinin ka bare atol man ke no sial man ke doctor ti al na manan naka ministry nyinin ka nyin ko membe kerin do nyadi lem for atol Gambian women's life matter as a group al nene reach out taliban because ali petition no safele sinya fula ngamra biling alia start no ngala force match no jibel no ali petition safe nyin do fanan ali petition safe bari fo petition o nyin alia futande ministry la leban aning ali mineke pour ka ministry nyin engage
Epa baraka baka ko mayata. Ning even aja Maimuna Sise ate katara UDP la dina yung grupo molu itolbe san sedea they are the one who take that latest. Dr. Samatela secretary asan sedea. Nta fanga Dr. Samata I still have his number. Nga call ako isina itata je pur ka petition no nyin danda.
right
Iko abe busy rina. Isita je ala family member do be na grupo kono. Waya call akai onkul tol bijar. Ako mbe busy rina. Bari ya kaito di secretary la. Ya dial. We press ke kotenke press conference.
yeah
We do the same thing. Not only that Samate, even American embassy, we always drop the letter to the president office, all these NGOs, because pur sama kam. So Dr. Samate, ntabiri ngaje dia mo ngalo nako. This is not the person. Abe jahal linne because na manta campaign yola. Atala palaso sutala.
yeah
So ate fanan bitala le bin diata mansaye abola falaje. But Dr. Samata Yalon Noko, even if we don't reach out to him, he already know there's Gambian women's life matters. Because woman mokumpa Gambia. So before they told me they connect me to First Lady.
Yeah.
Why those president office don't connect us with Dr. Samate?
yeah many be ministry to exactly
Thank you. Because wala do quote.
yeah
And for him to be saying that we are not healthcare worker, he don't know us.
Yeah.
That's the problem.
yeah
Aman tollo. So yala wala na ni jani ka kumo you have to investigate.
Yeah.
Jumala be nyinko koma. Who are they? Because akuma yata bakel.
yeah modo ya sa
Kuri yala
ako
jumala be
ayi
kuo
sa pela ako you guys wrote to them ako we wrote to them so
We do. We do. Why don't I sit here and say that we do? We do many times. Trust me. Even for him to be investigate some of the death and like they say they 5 people died because of there is no blood back at the hospital. I reached out to Dr. Samare. Ako hello. Ngafa, do you know what is going on in RBT yet? Ako okay, hang up.
oh dear
No more. It's sad because of money, people are lying. Dr. Samata
it seems like political reform because it seems like they don't care about Gambian women's lives basically.
No.
In general
No.
and because at a time at a better accountability like in social media and there is no way they can stop the technology
I know so the hospital. I just have somebody not 2 minutes ago I just lost a patient because of the electricity goes off. There is no electricity. Yeah. The doctor, I arrived at a status, so I go, oh my God, I just lost a patient. Gambia is a shock.
Yes, son. Ika no sol fangol bulo fandi because nga may brikama fana modo fata je labor because nga wala video nga moy alla major to kewanying de san young man he was very supportive to his wife akwati ala muso mako ile all the way through to the end but in
Isa is a wonderful man. Yeah.
That was very sad. That was
I borrow nyini you borrow to find out the host pharmacy momento welcome wo borrow so if wala nantolu we are giving them support. You know why? These people need tatapuri surata yellow phone. Ikabatale ka kodo bondi. Even the needles they have to buy it. Trust me, ask anybody. There is no glove. There is no this. Nyinsa wouldn't nakatalo kon. So modo phone father because of yanta test told me I put more test $2,000. nata da kala muso ko la kai ko nyuni me jube kai hani man jube ko ngang ibe ko dolo batuka.
Oh gosh,
That's sad. How can somebody lose their life because of $2,000?
in a state hospital. State hospital.
Banjul.
You know?
Banjul. And this girl, her husband is in London. I thought a test can you private hospital or to another ya fai ko idingo fati ko. She went to Banjul hospital. Itoli ya fai ko tolu manta test kela no jang ta fenke no jang until Monday, and this was Thursday. Somebody confirm it to you that go ala twins ol mini ba ko ne fatal. And that from akamunto ka to fenna sera baluba.
Yeah. What stories people can come find delay? It's
So that's why I'm called Gambian Olu. It's time to put politics aside.
Yeah.
Political will be a more nonsense. To me, it's not important.
Yeah.
Phenomenal important.
Yeah.
Let's show to people in Gambia, people in power, we have the power more than them.
Yeah.
So that if anybody come, they will not play with people's life.
Absolutely.
These are the things they will concentrate, because near more employee industry area like sila doku olu lopitano ninyo dula dolu. It's better than to employ wrong person in the hospital because of your family, you know, like people giving wrong blood. It's many times those things has been happening. Ama fono fanko Nancy Keta. Akafu Nancy, nako Nancy, everybody come. Nancy, everybody come. I have to go and look the last name. Okay, oh, is it Kueta or Keta? Because I don't understand the right thing. And the mother of the child come. So me see the compare. Oh my God, how can they employ this girl here? Somebody who cannot read people's name. But because of their families are in that hospital, they bring them to work there. Hospital and watchman, you can also trust me. Because more baby from the bullying the
yeah.
Lopitan
is one place me along ko me suntumbalon. Lopitan is one place me along ko. Imagine ka mo fije me along ko a mantre.
Thank you.
Ka mo fije me along ko.
Yeah.
Compromise no other areas so but Lopitan me along ko mo ni olebe. You know, it's a life and death situation. Most
Thank you.
But we all try and do everything.
No, not. You know, I don't want to hear them saying that ni watu sita fango itolo kami for ila nyim believe nyinko muso nyanta fala na be wulu wala life.
No.
You know, that's not the case. Nobody want to marry.
Yeah.
Ye konota.
Yeah.
Kita lopitano to ite furele ko duila bunkon. Wobela fa wartal wala kono fango bela everybody is scared whether you will you know what Fatimata, let me tell you, I watched the video.
Yeah,
this Fatimata Jawara said.
So is this a recent video or like long time?
It's yesterday.
Right. Okay.
Yeah, I think mean for all of you women's life matter. I think she was talking about me. Coming like on cafe on post Facebook. That's why now people are dying in maternity because if still can but you know, I don't blame Fatmata Jawara because people like Fatmata Jawara, Ninga Fatmata Jawara in the parliament to Konakamuto, Yalan Gunjurum Koli, Toloka Angalemo. Hey, Excellency, this and this and this. So Fatmata Jawara, Ninga Jibanko, I don't blame people. If she fight for Gambia, they should give her some money to work somewhere where she fit. But right now, I be old lab in front of Amanya Tarlaji. Because I'm
it's not a fight between government, wala politician or any Gambian women's life matter, wala Gambian women in general. Because Fatimata is a young lady. Fatimata Sitano Lopitan. Maybe saying Abedame, I tell a situation, she might go to a better hospital, maybe I tell Senegal or whatever.
Okay, I am not trying to interrupt you. I want you to know who this Fatimata is. This is the lady who come out and say that could like 7 or 8 men sexually abuse her at the prison. Let people know the girl is evil. And I feel sorry. No woman deserves to go through that.
Absolutely, no.
But why Abelodu platform momento is what political party would know later.
It
means that she's showing to our kids that it's okay for people to do that to you. She should use her voice and low platform multi-kafoko. Ala make soko. Alitana song. Ale $1 million. Atole tamal fountain. You don't deserve it.
and baling me kuntu fanang bari fendol bije wol ibuka je fangoma because ati man tara mamira ati mo specialist in health and if more man doko ke in health maybe as a political kenola without really going into detail kato lokuma maybe Dr. Samate Sako ko wo minister on that area ati nato so
absolutely, yeah.
to know but imang fat matala relevance je in
The sad thing is thousands of women are watching her because Talini, Musol Siatajir. Thousands of women are listening to her, which is very, very sad, and they will believe what she's saying.
It's
disappointing.
Yeah, it's disappointing.
I was having tears. I was very, very, very upset what happened to her and the other people.
Yeah.
Because no woman deserves to go through that.
No.
But
and
after when I see her, what she said yesterday,
yeah, she's a survivor. She expect
she is, and I am still very sorry that happened to her.
Yeah,
I am still very sorry. No woman deserves to go through that.
So wala na manya na kake moti manya na ka nying sifal mo
Yeah.
manya na kate je nying area to fanka dia mo ke ni if anything
wala nang koy ma sama dulata nyenta tarla damin. Thank you.
Yeah.
Ya na wodo jabinaka.
Yeah.
Gambia buka motarandi dulata. Even Adam Barrow is not he should not be the president of Gambia. It's like insult to us.
Accidental president leti but aku mo kana fine.
We don't care whether accidental president. It should be somebody who is well educated. Yalong nga funding ke jumale so mini yalong ko do deserve that position. Mi yalong ko mo ni man karang ibu ko do no.
Yeah.
So ntolo be bata pour nga bondi bata ko no abe kola yala la because ntolo ka jibele ko moro le ko kari taraji. Nana foy nyine be na banko batandika. Alinga nyi moria miro bla. It's like atolo ka bim fo jalang. Jalang man tabiwoti. Ye ala jeta ka mim mira ke la ko samba nyewol to anti babulu abijanne. They have psychics and all this stuff. But ila knowledge ni ika ke londolati. Jang ni man wo karang be karang takita tatarla muli nyati lo no.
But in Bali yalo ko Gambia man karango fonka Gambia hani karang bata is a problem.
Wala na fanan be koma.
Yeah. Gambia man karango
because small mini karanta what they deserve they are not getting it.
Yeah. They don't
people
value
who are
education
not having
at
nothing.
all.
Mini along payment to defend the focal silo can do more than they are enjoying more than any other people.
Yeah.
And that's not fair.
Yeah. That's right.
It's not fair.
That's right. Mbali nga baraka bake malo yo muna suto kumalabong la kolol bedungkan na nenga modo sa telenyan samala nang mala yo muna suto
if abaraka nte be min folete ko yebe do ko mina continue. You are doing an amazing job.
Thank you.
And I hope Gambian people can hear you. And nte be min follow the nyinte ko Gambia women's life mata ntolo mantara politiko kon amanki politiki group ti ntolo mo sifa bere bije. We are only fighting for better health care. Because I think Gambia deserves a better health care.
Right.
So Mafala Gambian will be again, Gambian women's life matter is non-political. There is no politics nana to women's life matter. Politics is JB, politics is J Soma, and I stand by that. If Abaraka Bake, thank you so much. Thank you for
Thank you so much, Bali.
No problem. Thank you.
Your whole team, you're doing amazing.
They are doing amazing.
Yeah, and then Bafalali they don't control for Nambal Komale to support you in any way that we can. What a new platform where the
Of course. And it's
we're around.
Yeah. To be here today.
Yeah. Thank you so much.
Thank you.
All right,
Thank
bye-bye.
you so much.
So, saying a call today. Hello, Mayama. Yes, you're right. Mbe Mike, you have to contribute, like what? Yeah, okay. Matungeke on speaker. Welcome.
Okay, no problem. Thank you very much. Thank you. And Ngamira, you should do more of this. Kanu nyimbe molma ko ilale. Ye ko kuje I dialogue le need, especially health matters. Yajel. And what I like about Ilanim program you are not doing it coming ibe kamfaring or ibe whatever you are discussing pertinent issues many alonko I Gambian musole affect and we need to do more of that because if you are willing ni left a kuonyinela ya nyini silo la mi alonko ibe mindiamu ka ya lonne ibe information o mi present ka ya lonne mol mini ya lonko ibe mako ro nyini ka wolle bulu you understand? And hanna tere ba deny lale. At the back of their minds, if I follow ko alinga wulinga kuke because you can mean for to nyalem and we can mean for ya lonne. Yajale. So I think nimu program or me along ko inimbaling al nyantalem nan sa akeno more often that would be good. And personally, I will take. I just want to make a disclaimer. Dr. Samate is my cousin, right?
But
oh yeah, he's my cousin. He's my cousin. Yeah. So, but anyway, membaling tend to lambaja because mbaling aladuko is selfless, right? Mbaling be minke kang aninga be min try kan pro kana Gambia hana tra kan minu fo dam ma post lem rek because what he is doing is raising awareness and near awareness you raise ika mo jamale wulindi ye do ko
that's right.
So yeah, I appreciate what she is doing and then I appreciate the fact that about she's tireless about it and she's passionate about it. She's not doing it for publicity purposes. She's not doing it for anything about cake and because she cared. And ikajele in Facebook more member because they just want publicity and more member because they cared. Mbaling cared. Well, even though sometimes when he goes after my cousin, it pains me a little bit, but I still shut up, because I know, she's passionate and what she's saying is true. But I really want to left at the because different healthcare system I'm not a meta system on ne healthcare katamanyadi at least in America man Gambia lombake but America ngalone akatanyadi le mune atin nantola healthcare jang akatamanu and mune atin na Gambia la healthcare and into la healthcare the disparities in between mune muwati I did my own research on this. Kandung kabrim balimbe ni aka kumatika post. Nte mumusole nga badi ngol so minu be Gambia. Hani Dr. Samate or Dr. Samate la no sol minu bije or ibe mol so in the Gambia mini along ko these things can happen to them. So ning every day iba willing the ibena la iba ko kari banta ni mu moti mi along ko balafa be la le o mu moti ibe wuli la le fana ya jube mu ne be caring. What can we do? And that's what I did. You understand? And to take all biasness out of it, Dr. Samate, I didn't talk to him. But I did talk to other people in the ministry. Who is calling? They just know he's a concerned citizen in the US. You understand? So I talked to these people. They on a day-to-day basis. Dr. Samate from Maternal in the hospital on a day-to-day basis. You understand? He goes there to do surgeries. But sometimes from time to time, but I think on a day-to-day basis. So I talk to those people and I gather my information and I put it out, I think last week or the week before, if I'm not mistaken.
Right.
But nobody reads it because Gambian no. Ibukari. And these are some of the findings for it's true. And but in fatu ite aloneko musona konamat it's not only the responsibility of the the hospitals or the healthcare system, but also the responsibility of the woman to take care of themselves.
Right.
Women in the Gambia sensitization on both sides, on the side of the government, so the government can start spending in the health sector, and on the side of our women, so that the musuls take care when they are pregnant. Because honey young need at a hospital of ni America Bangkok. Ila Dr. Kafu in the book. Kana nyinke, kana nyindomo, kana what responsibility needed to stay at doctor hospital, need to the hospital. What responsibility it rests on you. It doesn't rest on the health system. It rests on you as musomi pregnant. All my pregnancies were risky pregnancies because I developed diabetes, gestational diabetes.
Gestational diabetes.
That's what I have. Fatu, if I tell you the things that the doctors write to me and say, and I make sure I follow through on all of that because I want to have a healthy pregnancy and I want to have a healthy delivery. No. The 90 days, every day matters. What you do in each and every day matters. What you eat, how you conduct, how it all matters to your body.
Yeah.
Because nibe ninkono be la fatu ibe jimila duma ibe femol sikala mi yalla ka kuliyatale asatina no it was a bridge. It was a bridge, and that is a complicated pregnancy. Needing a bridge that it will come blue. Abe koleala, and Gambia hospital my equipment also to me yalonko. Imam thing also to me yalonko. Is it a mari mako Juna?
New complication also to
Exactly. So you as a woman need to understand that so that nkana nying femol nkana jimi duma nga kuro ke for tiloye boy you understand nga kuro ke what you want nkana nying duno sika nga jimi nga nying duno sika nga landi o ni nga singoje abe yitika mbatu nga mbore nga ta hospital nga nkana ko jama doma nkana nyinke that type of awareness nyanta wo sambalan musol kanne because nga feel like leko ninga wo awareness sambalan musol kan nga government pressure for spending la kuma se ka spend in the hospitals ka kuma in ka femol nati mi yalon ko be wala san ibe jorangol nati la mi yalon ko ibe wala nati la in the hospital for ka musol makoy ninga woke but I think we are going to see a lot of changes a lot of healthy changes. But in Nimbe focus come more killing on come, or be focus come government come, in this side no we are not gonna go too far.
It is a collective responsibility and holistic approach because near jamma, because like you said, individual will have to take responsibility as well. But interestingly, bring any research jibos the research on health. Figure Mariam. It shows that majority, like 85% of Gambian women, many along economically surveying based on menoto, antenatal care sotole. So they were actually going to see a skilled healthcare professional. Because a lot of people say, "Oh, you know, nurse, you hopefully in a moment, be midwife, sotola janne right now there." But they were saying like these points you were saying, model bukata nurse, ikatale, because Moya Fontaine for 7 months pregnancy, and a mananta nurse. But this research is showing something else. Actually, they were actually going to see your survey based on the 100,000 people that they've spoken to, or whatever number that they've spoken to, 95 or 85%, I don't remember the figure, will be pitakan nung lopitani, and they've been about 4 times or more to for North Star, so people are actually taking, but you know, you're right, what you're saying is it cannot be just one side of of the coin. It has to be.
Where the nose will you mean for are they doing it?
Okay, advice for local, yeah.
Exactly. That's what I'm saying. I'm not saying more nose in the Gambia, diabetes, hospital,
that's right.
So that's what I'm asking. Sensitization advice in the hospital. You guys need to follow those things. Prenatal care, whether are they following it? Those are the questions we need to ask. Because complications in pregnancy doesn't happen only on the day of birth.
No, that's right.
It doesn't happen only on the day of birth. It starts happening sometimes earlier in the pregnancy, or sometimes later in the pregnancy. So near complication or near what detect. Are you following those recommendations? Are you? Do you understand?
That is important.
What happened? Right, it's very important because look, we reach to where we need to go to. Need to be fixated on one thing. what the mabuka solve no, because before Dr. Samati comes to play, the Dr. Safimboj, we people went after her. That woman, they ran her out of town because they went after her. But Kabri Wapotaji, I said to what is the name of I said to Turenata, nothing changed.
No.
Dr. Samati, nothing changed. So now what we need to realize is that what is the problem? Because in Jama investigation or research, if you are doing it, you are doing the same thing over and over and nothing is changing. You need to step back and say, how do we need to approach this now? Right? And what are we doing, or what are we missing here? What is the missing link? You go after that too. Nobody should be reserved.
Yeah.
But look at Muneati and Yimang walk no. And don't think this is what is happening. Through my research. Okay? Fatu ngamwele in the millions of dollars lenati in the hospital during the time. Those millions of dollars mostly it was geared towards, it was spent in a way, it was geared toward COVID. It wasn't maybe the corruption went on.
One of them was geared towards COVID, the $21 million. That one was geared towards COVID. But we've seen that the COVID period glossol mangsoto when we got Dr. Samati Fangayafo Molianako, he was in the beginning I corruption all for many along in the healthcare system, and he was totally against it. Nga figure settle on $4.3 million may along what is purposely for from the World Bank grant and what for maternal and child nutrition project. So that was basically specifically for that.
Yeah. So look at the 4 something million. Okay. So because I work in the healthcare system, I know how pricey health equipment are. Needless the health equipment $10, how pricey they are. That 4 something million, that is a drop in the bucket, because even just a maternal bed, me is $6,000. Me is $6,000. So just look at how much that is, because near figures all but the healthcare equipment are very expensive. They are very expensive. Now, let me tell you this. I'm the first person to tell you Gambia corruption over and Dr. Samati corruption is there. They still eat our money. They still, they are not putting the things where they need to be. World Bed Fire in Gambia, and people need to pressure them so that go after them, so that But Nina healthcare spending la party. Healthcare system even though we are a small country, because our healthcare is so much in shambles, a lot of focus by the government needs to be on the healthcare, so that you could pump into the healthcare system. Maintenance include in that maintenance better maintain so that we equipment will self-life extend so that more on an operation bed equipment that should not happen in the country.
Absolutely.
But all that, you have to pump money. It should be your focus. Ni healthcare mankela focus di. For campaign le muila focus di. Kudo le muila focus di. India mo mimbe nkanyimimbe for it. It's not gonna work because healthcare requires money. I money le require. I andunima wo money kije atitala no.
No. For it's a prioritize. Your money pump je.
Yes.
Yeah.
And another thing which is one thing reason why Gambia healthcare system or mantara tama kampatu. This is universal healthcare which is more ni pareta ni at the hospital. Everybody can go to the hospital. Haniman kodos to the hospital. And that is it's a right of everybody for healthcare. Healthcare needs is satisfied. That's the right of everybody.
Yeah.
But near Juventus system was set up the and in the hospital, maybe you pay a minimal amount of money to get help, right? But if you ning because hospital mambagas also yetaje we are kind of taking more from the hospitals than we are putting into the hospitals.
Yeah.
So what happens is it's a Gambian or Jelenata in a hospital in the Penjamajola water because that's how it is set up right now. But in the private hospitals, they pay thousands and thousands and thousands of
quite a lot of money.
Private entities and need at what Hanina Musokonamal near complication also to draw ye bondi private entities ye not back to the hospitals there is nothing in those hospitals. So can you imagine we are Mekodo pumping into private hospitals, Kodo Mantaratakan into public hospitals in terms of me use maintenance or
facilities.
Exactly. Then Nimpota private complication also the private hospital we run back to the public hospitals.
Yeah.
There need to be a system, Mia Longo, at least more in the Gambia, Mia Longo, you have an income fatu. You are able to pay a premium. Premium, your income also to premium, whether it's in the public sector or in the private sector, you have a premium, Mia Longo, you pay it into the hospitals. So that hospital they can have their own budget. Because right now, hospital budget over from the government. Ning government man fenko dila. Namang ning government man kodo dila budget on dila pour spend. They don't have money to spend. They don't. So near budget what that for the physical year, the physical year, you spend this here, you spend this here, you spend this here. Near what dila. Spend but the demand of in healthcare increases. The discrepancy in the hospital. Control with any funds because the only place that they can go and get funds is in the hospital. It's from the government. How about the hospital funds because people are going into the hospitals and paying a premium? It's a use maintenance get a generator fix the hospital better conducively so that our hospital system can be what we all desire to be. But we as individuals and the government and even pregnant mothers to being a responsibility in this to make sure being a side fulfill. That's the only way we can get to where we will get to. Because one thing from one minister to another, we have been, going after them.
Back and forth,
we have been going, nothing is changing.
Yeah.
Why is that? That's the question we need to ask. And for me, what I did find is the spending issue. We are not spending in our healthcare like we need to.
And domandingo Mariama domandingo bemendundi kanje wofana corruption o yati na abuka use appropriately anyanta use la nyaming because of
exactly. And let me tell you why that is important. You need to have a mechanism as to iba follow la nyaming, track la nyaming. You need to have that mechanism. But if this is what is in the Gambia. You understand? Figure out just imagine Dr. Somebody going to the parliament and saying there is corruption. You know how much flack he got for that? You know how much flack you get for that? You know how many people in that hospital who are mini alonko, they don't even talk. They don't even talk to him because they are still upset at him that he went and say something like that. You understand? And the thing is, there are people in the health sector, many alonko, right now, coming Bali Yeminfo, they must qualify for Karaji. They don't know how to work. They are not competent enough to be in it. But if you as a minister or you as a director, you want to fire those people, you know what happens? You have to be able. You have to go through the public service commission. You have to go through them. You need more fire in the hospital. In England, where you are, in America, where I am, right there, and then they fire the person.
Absolutely. Well, accountability today. No one is held responsible for anything.
If you say somebody is the minister, but you don't give
But do they not have that power though, Mariama? For more power, Minister more power.
They don't have it because they have to go through the PMO or they have to go through the Public Service Commission. One letter approved, Jumale Nyanta file, Jumale Manyana file.
That is ridiculous though. Oh no, that's ridiculous. Yeah.
We need to, you need to do your investigation. You need to find out. So near nurse also in the hospital, Mariman competent, and you want to fire that nurse, you want to fire that doctor. You cannot just go and fire that doctor. You just have to go through a system. They need to be fired. And guess what, Patu? Nita the PMO or Public Service Commission. You know what they do? They get that person out of that department and put them back in another department. It's just like you recycling the cancer in the system.
Yeah.
If cancer you recycle in the system, that is just so ridiculous and so undone.
That is absolutely ridiculous. I cannot even understand that, Mariam. More understand now. How? So, that is strengthening the system then, because not like health minister by nola, it's like immediate boss by nola. They can't, but can they even discipline you? Come like near negligence.
Exactly. This is the problem in the Gambia. You know, this is accountability. It doesn't work.
No.
It doesn't work.
Yeah.
You know, so you know, the firing and the hiring is done by the PMO. You know, so need to help minister. They call Karibi Janne. Amantara Dokuala or Karibi Janne. I'm a corroborine. You have to make that recommendation to I think it's the Public Service Commission or PMO. You have to make that recommendation. Then you investigate. They do all their investigation. And because Gambia nyim boka, kisuma mbokala, kisuma mbadingolo, or kisuma friendla, or kisuma nangam. What they do is, instead of firing that person, they turn around and put that person back in the system.
Yeah.
Somewhere. So
it's really bad.
So what change is going to happen? Gambia, healthcare system we need to have some structural changes.
Yeah, but woman it's meant to happen within these 4 or 5 years by woman soto. So they are all linked. If you look at it, it's a structural problem. Structural problem it's affecting all sectors. So if they tie in, let's say what you've just told us, this is a big information. Many are control malong. That's the case, because we're talking about accountability. But if the minister cannot even hold a health professional accountable, then what are we talking about? You know?
Exactly. And that's what is happening in the Gambia. And what I'm telling you is the truth. And no matter in a public platform, they can go and do whatever. You know, that is what is happening in the Gambia. We have incompetent people in places of our workforce. Many are long honey na hospital. As a patient, you are rude to the person. If I'm married, treat like in a way you understand? If you are, our hospital should be an environment it should be a sanctuary, a place of peace, a place of peace, a place of respect. With respect, with the utmost care. But it go to our hospitals, you know, and but people are not very aware of customer service as they are in Europe and in America.
No, that's right. Yeah.
And all that matters to the well-being and the welfare of the patient in the hospital. All that matters.
Yeah.
The patient who treats in the hospital, all that matters. So we have to look at the system and structurally change this system, because what we are focused on right now is bringing awareness, but I'm afraid it's not going to produce a lot of results, because what the issue
no, it's bigger.
It's deeper than that. The structural issues.
Yeah.
We are going to keep having this problem.
That's right. Thank you, Mariam.
Shows like this, is doing and what genuine Gambians who are genuinely concerned about this are doing. This is what we need to do. Alingan na structure and change so that certain health, certain departments that are very crucial, like the health department, like other departments, let those people have the the right to fire and hire on the spot. If you know that you are going to lose your job, if you don't do X, Y, and Z, you will do your job.
Absolutely.
You will do it.
Absolutely.
You will do it. But if you know that, okay, if I don't do my job, I can go through this other system, and I may still maintain my job.
Yeah.
You
will continue messing up. Absolutely. Absolutely. You're right, Mariama. Thank you so much. Thank you so much, Mariama.
No worries. Thank you.
All right. You take care. All right. Bye. Wow, that's amazing. God. I am short of words. I really don't know what to say. So yeah, so this is why it's important that we have these conversations, because maybe so this is for the journalists now to go and dig deep into this, because yeah, it's a structural issue. The problems are deeper. It's holistic approach. So what I'm gonna do now, Mbe Hadi Juf called from Midwives and Mothers, because she was trying to get hold of me on here on video, but in Gambia she's struggling. So I'm gonna try and call her. Isajiko, we also ask her a few questions about Itolfan Nadoko in Gambia. Hello, Hadi. Hello, Nahangadef. Wow, sorry, you were trying to get in, but it was difficult. I think your network is not letting you to join.
Yes, it was very difficult for me. At first it was good, but not anymore.
Not anymore. Okay. What language would you want to speak in? Mandinka, Wolof, wala English?
I was speaking in English.
English, okay.
Yeah.
Oh, what? Sorry?
And probably mix it with Wolof.
Probably mix it with Wolof. Can you all hear Hadi? Hadi? Okay, let's carry on. I think people would let me know. So Hadi, very true. Hadi, you tell us, you were from the Midwives and Mothers. You are a student at the MRC, I understand, and student nurse.
Yes.
Yeah. So your work at Midwives and Mothers focuses a lot on prevention. So you support women by providing them with nutritious meals or helping them to access the healthcare system. Can you tell us just a little bit about what sort of support you give women?
Okay, thank you so much, Fatu, and I'm very honored to be here. And we are very grateful as an association in the Gambia, trying to add to the reduction of maternal and infant mortality. First of all, my name is Hadi Ju. I am working at the MRC, also part of the Midwives and Mothers Association. As an association, we emerged.
Can you speak a little bit louder, please? Sorry.
Okay. Sorry. I said, as an association, we emerged in December 2019. We did a thorough research in the Gambia, knowing that maternal and infant mortality on the rise. We could not know what actually is the cause, and still people are blaming each other. When it comes to the doctors, they're saying it's not them. When it comes to the government, they're saying they're doing their best. When it comes to the women, they're still saying they're doing their best as well. Nurses, the same thing. So we did our thorough research, got to women, went to visit the hospitals, especially the maternity unit, and saw a lot of terrible things, which actually supported our motion to form the organization.
Right.
So what we did was we got to a lot of women, got to chat with them, have a one-to-one conversation with them, and it was really touching. It was very sad. A lot of us cried because of the stories we heard from them. So when we got to them, we talked about the things that they think is causing these maternal deaths.
Right.
So from their side, they're saying probably it's hard because a lot of them don't like discussing about it. But most of the things we hear is about abuse. their
Abuse.
husbands, family. Yes. You could talk to somebody and they tell you, my husband is beating me. My family, my husband's family, they're not giving me peace. So when I get pregnant, I walk a lot, I do a lot of things. Another thing is my husband is not giving me money to do my scans. My husband is not giving me money to go to the hospital because a lot of them live kind of far from the hospital or from the clinic they're going to. So a lot of them are saying I'm not getting the right things that I'm supposed to eat, the right food that I'm supposed to eat. These all comes down to their homes and where their marriage lies. When we talk to nurses as well, they say they're doing their best.
Right.
But one thing that we came to a conclusion was, even though the things that are lacking at the hospitals, even though we have a lot of nurses, but still we need more. Midwives are doing their best. Mothers also are doing their best, but are kind of lacking when it comes to them attending their antenatal clinics, them doing the right things they're supposed to do. Because when we started, all of the women that are under our care,
right,
to be honest, we never had any deaths.
You never had any?
That is something. Any deaths, like actually.
Okay. Yeah.
Yes. So what we do is we paid for their scans.
Right.
A lot of them, we have a list that we have, a lot of women. What we do is we call them to our office, them the nutritional things that they need, like food items, like the baby stuff. If you get pregnant, we follow up on your case. We do vital signs monitoring, blood pressure monitoring, PM, weight, and these are just things to be alert on the alarming signs, like pregnancy-induced hypertension, diabetes, and all of these things that might actually happen to pregnant women. And if they don't know, would actually be fatal. And if anything happens, we just take them to the hospitals. We know their date that they do to deliver, pay for their scans, and then that is how life is going on with us. Unfortunately for us, we've never had deaths, and we are continuing to reach out to these women. Right. Currently, we have our subgroups, like the neighborhoods. We have our boroughs in there wherein women come to the leaders in those particular communities. As in, we have the Greater Banjo area, we have Kulari, we have Basse, Fas, Njagachoy, and the like. We only do not stop there. From there, we also engage them, because a lot of these women that we have, we don't only pay for their scans, we don't only give them the necessary food they need, we don't only give them the baby clothes, the baby foods when they deliver. We also try to support them, as in have a small business for them to help themselves, because a lot of these women, when their husbands have more than one wife, they are able to do a lot of things for themselves. This is what we do. We call them, have a one-to-one interview with them, have a little chat with them, ask them what they want, and the kind of business they want to do, and then we invest in them.
So you're basically taking a holistic approach. Basically, you're not just looking at the health issue, but you're going into the homes, looking at these complex issues that can contribute to maternal mortality and preventing it from happening.
Sure.
That's right.
Sure.
How many women do you have at the moment that you're supporting?
We have over 100 women.
Right. And are these women accessing service through your center? Because I know you have a center as well in Gambia, like a walking center where people can come in and pick up necessities. Yeah.
Yes.
Right. Right.
Absolutely.
Right.
Yeah.
That's great.
There's one case as well. That mother was actually part of our group, but then lost her baby. That was because when we met her, when we were trying to make her come to our group, she was already 8 months pregnant, never gone to the hospital, do not do scans or anything. But at the end of the day, when we got in touch with her. We were able to help her and everything. She delivered, and unfortunately, the baby died because she had sepsis. The baby had sepsis, and she was already hypertensive. Another one was the woman was not part of our group, but due to the people leaving around and knowing our association, they actually gave us a call and said a woman was in need of our help. Yeah, because the woman delivered at home, did not go to the hospital because they didn't have money. The husband did not have money. We managed to take them to the hospital. Everything was set for them, an IV line. She was able to eat and everything, but unfortunately, she died because actually, there are a lot of complications that happen when you give birth, especially out of the hospital. Yes, you might give birth, the baby might be out, the placenta might be out, but there are blood clots inside of you, and that is kind of internal bleeding, and then there are a lot of things that might happen. So it actually disturbed her. But fortunately, the baby is in our care. He is 9 months old now, and we're giving him allowances and everything. So this is why we are here to actually help women and babies as well.
Great, well done, thank you. I think this is very important. I don't think a lot of people know the vital support. I'm sorry, I'm getting distracted now. So I don't think a lot of people know the vital support that midwives and mothers are giving on the ground as well in the Gambia. And so that was one of the main reasons why I wanted you to come out to talk about these things. So if a woman is watching right now and pregnant, or wanting to be pregnant, how do they reach out to you to get the support that you have on offer?
Okay, so this is what we do. We make sure that we reach out to every corner in the Greater Banjul area, where we have at least somebody who will be responsible for the women we have around there. So as we know, we're all Gambians. We know each other, and then what I know is what everybody knows. Like, tell a friend to tell a friend. They always communicate. So if anybody happens to need any assistance regarding pregnancy, postpartum, or antepartum, they actually reach out to that person, and anybody who knows that person actually reaches out to that person, and then he or she gets back to us, because we do not only have women out there, we have men as well. Yes, so they get to us, we register them, we make sure we have a form for each and everybody that we are registering. Have a form, have your details, have copies of your scans, your documents at the hospital and everything, and keep them in case anything happens. We would actually know probably this is the cause, because there's something about maternal death. Even though you might be going to the hospital, you might be doing everything that you're doing, the doctor might be helping you, the nurse, the midwife, but people do have problems that you don't know. For example, if you go to the hospital and then a doctor tells you, like the other woman was saying, a doctor tells you you have diabetes or you have hypertension, you should stop eating salt, you should stop eating sugar or jimbo, or things that would actually be complications, and then you should be eating everything, and at the end of the day, you get problems. Or you go to the hospital. I've witnessed a case like that. The doctor actually told her, okay, this is the thing, I know it's hard, but then you have this particular problem, you have a heart condition, and then your heart is not pumping quite well, and then when you're pregnant, your heart pumps twice as whatever you were doing with it, so you are not able to get pregnant. Even if you do, you would have problems and you might die. And then she said, okay, this doctor is trying to play with my life. I am living, I know I am doing everything possible, I must have a kid. It's not easy. It's definitely not when you're told you can't be pregnant anymore, especially if you don't have any kids. But actually trying to prevent those complications might do well for you. And these abortions that people term as being a great help, it's not. It actually ruins everything. At the end of the day, nobody knows what you took, nobody knows what you did, and then you end up losing your life, and that adds to the number of maternal deaths we have. So I think all of us should help one another in combating these things that are happening. It's really sad. to be honest.
It is. And Hadi, before you go, I would really appreciate, I know Aja is watching right now, to put the number, because I know you did say it's who you know, tell a friend to tell a friend, but it would be important for people to have a contact number of midwives and mothers so they can contact you should they need their help. So Aja, you are watching right now, please do put a number down for people to be able to reach out to you, because you are offering such a vital service. It's more about prevention than anything else. There's one more thing I want to ask you before you go. Have you actually reached out to government, or does the Ministry of Health know about the work that you're doing? What sort of engagement have you had with the ministry so far?
Okay, thank you so much for that question. To be honest, we have not actually engaged them like directly, as in one-to-one conversation and all. What we did was we went to units, like we went to this hospital, Gambia Foundation, that is Bundung Maternal, and also the EFSDH, like these maternal units that are basically like vital and essential, especially like the biggest hospital that women are being referred to. We actually had conversations with them, the nurses, the doctors, the midwives, and actually had this rapport that we have, as in anytime anything happens, any of the services they need. Actually, we had a doula training that we were the first people to introduce that in the Gambia. Other countries have doulas wherein if you're pregnant, you are given a doula to take care of you till after birth. Right. So we have that. We also do doula support to our women. Actually, how to, like, it's very important. The midwife cannot do anything, everything, as in the breathing exercises, emotional support, psychological support. Everything cannot be discussed on the table, but these things actually, we term it as things that help. But we reached out to a lot of doctors and a lot of nurses as well. Right. Okay. To make sure. Thank you. Yeah.
I'm just reading the comments now. I think the whole purpose of this talk today is basically to find out ways of complementing each other's efforts, because midwives and mothers are doing a great job. The Gambian Women's Lives Matters are doing an excellent job as well. So I think it's more about complementing each other's efforts. So if people are watching and they have a pregnant woman that they think may benefit from this service that Hadis just mentioned, you know, it's okay for a Gambian Women's Life Matter representative to send somebody, a pregnant woman, to this organization and say, look, if you are struggling with fares to go to hospital, they can help with that. There's nothing wrong with that, because it's not really a competition. You all are doing different things, but for the same people. Okay, you all have basically the same aim. You have different expertise, and I think that expertise, or those expertise, can actually complement each other. So please be civil and try to work together, because working together, it's a big issue in Gambia. I think teamwork is a problem for us. So this is something that we need to start doing, especially as women organizations. We must complement each other's effort. We must be seen working together, because no one single organization can tackle maternal mortality in the Gambia. You guys cannot do it on your own. Gambian Women's Lives Matter cannot do it on their own. Say Ture cannot do it on her own. We have to complement each other. We have to work together to be able to sort this problem out. So thank you so much, Hadi. We really appreciate your time. Yeah, do you have anything else to say before you end the Yes,
I would. This goes to myself. It goes to any other person who's watching. This goes to the whole world, the Gambia in particular. Gambia is our Gambia. Regardless of ethnicity, regardless of politics and everything, we all still a Gambian, and that is what matters. If we do anything good, it's for us. If we do anything bad, it's for us. So actually dividing ourselves in doing things, or saying things, discriminating people, or things would not do any good for us. There is maternal mortality, and the rate is very high. What we should focus about is trying to come together, be it the nurse, be it the doctor, be it the midwife, be it the mother, being the government and the health sector. we should come together. These are the vital people that should be fighting this. And this goes to my beautiful women as well. Let us be attending our antenatal clinics. These are very important things. Like, it's really funny how they go to the hospitals and then they say the fancida is very not good and the drugs are. These are things that would help you. You have anemias, you have several things that actually happen: sepsis, eclampsia, and hypertension, diabetes. These are crazy things, and the doctor would not know whether you have them or not if you don't come to the hospital. So these things might kill you in a jiffy, and we do not want that. Everybody who gets pregnant wants to deliver in safe hands and also wants to keep that baby so they could become great people. So I would like to say a very big thank you to you for inviting us midwives and mothers. But I would not leave this platform without thanking a great woman called Maria Trawale. She is the co-founder of Midwives and Mothers. This woman is great. This woman does a lot of great things, to be honest. I'm not saying it because I'm part of the association, but she's helping a lot of Gambian women. She's not only helping pregnant women, she's helping the general public. And who would not see her work would not know what she does, but she's great. Thank you so much.
Thank you so much, Hadi. You're wonderful. Thank you so much. Take care. All right. Bye-bye. So that was Hadi from Midwives and Mothers. Like I said, if you know of women who are struggling right now to get access to antenatal care, call them. Call the Midwives and Mothers. They can help. Call the Gambians Women's Life Matter. Call them. They would help. Say to Reisia, there are so many different small charities, you know, that are supporting Gambian women, and really the work should be complementing each other. It shouldn't be a competition, and it shouldn't be oh, Mbaling is calling again. Okay, let me just pick Mbaling up. Mbaling, nah, oops. Can you hear Mbaling? Ilafta ngake loudspeaker, yeah?
Can somebody come?
Hello?
Can somebody come?
For some reason, it's not coming up, Mbaling.
Really?
Yeah, now, yeah, you're on. Go.
Okay. Sabe Hadi.
Fine teller now.
Thank you so much, Hadi. Personally, information
Yeah.
they will be very helpful.
Yeah.
And I hope Musoli mini baby la moika videos here for people to hear what she's saying.
Yeah.
Because it's very, very important. I mean for young Akumaya the back. Akumaya the andung interview me for the victims so we just don't want to come to the TV and say we do this for you, we do this for them, we do this for them. In my culture, we don't want to say that. We think that but we cannot keep helping. The husbands need to step up too.
Yeah.
Because why I say this, it is a responsibility. If you understand? Even here, we only help low-income peoples. Some of them are disability.
Yeah.
In America, you have to work hard.
Yeah.
For everything you got. Our country cannot be developed without people working hard too. Well, and I get all because are important than this is a very important part.
Yeah.
Ni alon ko kono fanambela musola ye fankanta mandin ko fankanta kurto mone buka fara
yeah
mo inyante fankanta lale you make plan B monon plan B alaman tankala even ning among fatinoto if anything happen to my wife nyanta mune dila dimbaya because niya nga nyum fo musu jamala katar lorin kella dañi nem bunda and that's not fair for us. And take care. And I point me for things. It's very, very important point. Pregnancy sometimes it develop different place. Me along woman so early
antenatal care is very important. Nin kono bele tal lopitano to. Ya long fele nyun kono abedulale ni to mi ya long kapetea. Akumaya to ba kele puru na molu ngata lopitano. You know how we sensitize them? Until what we do when like nyin tekila link will be carrying, many people can be witnesses about that. We don't want to say everything in internet. There is some information we cannot see it on the internet. Gambian women's life matter. Mom famous came tenkede. Niya ye man sakundal fo be no mani mol be no kumo fele. They know how powerful we are in Gambia, and I think all the Gambian believe that. They know how powerful we are. You know how we are powerful. Until not powerful nyadile. Ni musoli be tekila la yaro Gambia nyun turusi ata jele. Nka ebele tabiye. Toluka kobin toluka yaro Gambia no tanolo be na be no sidulato. Ye na ilu afu kunte kai tumu musukora malti. They don't want to hear that. Right. They always hide their pregnancy. And we know all these things start at home. Ni akumasa suwala kono. Why not for even the husbands who take responsibility to donate the blood for their wives? Yeah, that is crucial. Yeah. And number two, they should know. Ila muso la condition of benyadi la muso kana nye muruba di tala ya domo. It abe chalo domo because he just want to make you happy. Yeah. All those stuff are happening in Gambia. Wala nye mempote mbali. Abuse ni liparo ni ngani emotional abuse, financial will baby cool kono. If you hear my interview with Gunjur online yesterday, I saw it. I said that the many ladies will help. If let me tell you her story. Atata tilinyan dula to manyo tilinyan ta sister ya na to sarweli jama ba sambanyin boxing tomorrow ni. She was 8 months pregnant. Ala illo ni ya fa idron ko domoro fel aya nyonti. Yes sir. She was 8 months pregnant. Jabang Abu Sandita. Bida Abu Sandita, ala nebo lentol call because the in-law was threatening. The husband is in Italy. In-law nyimba batandika na watu watakafa ipete dingo wulula ja ita dingo wulula nyum kordako na nyum bugu yado amfido. And that was their first child with her husband. So then they rushed her to the hospital. And your baby in your body, you know, of course, the baby died right away, but thank God she's still alive. Right. So what we do, we don't want to return her to that situation. I offer her my own home. Yes, sir. So that's why I write it on the Facebook, or we provide shelter for them. But these are something we have to keep their privacy too. Yeah. Because so you guys are also doing a bit more of national TV and say that this is what we do for them. They will run away from you. Yeah. That's right. You have to do it in secret way to let them have confidence and that go. It only if secure in it because you know Africa we bully each other. Yeah, stigma kataraje. That's right. Stigma kataraje. And we should find justice for them. We should help them. What we do to that old lady, arrest her for 3 days because she's responsible for her own grandchild death. Police or arrest, samba, I mole call, and then like if you look at our page today, modo ya la muso faja, you understand? This young medicine America right. Kamaroni, if I get a page I send it to you. Sunguto yalo niba futu okon. I ate min kai o fala ya kebis mento kona ya jeni police or yamta. Gambia no be le page ya wole bijanyi watu kono kunu. Kanafubi. If Kubekeri yalo nibe futu okon. Ana manke ko inike madam Maternal, ibo kordako ni mi anonko say violence, get out from there. Yeah. Domestic violence is a big issue. Yeah. Always put yourself first. Why, even if you get into the plane, I will tell you the example. Because some people are doing this, our education level is very low. Yeah. It's not like you go to school, you have a PhD, whatever. My own child, even, you know, everybody know what I'm telling you. Neighbor plane, you know, the flight attendant will tell you, put your oxygen first and give it, put your child oxygen first. Because need no oxygen, so how can you help your own child? So always put yourself first. First, yeah. It's important. Yeah. Don't put anything first. Yeah. It's formally important to anything. Yeah. And what I want we all to talk about it, our hospitals, there is no electricity. Why I say that? There is no standby generator, remember correctly, and we hear the victim's family are saying that. Yeah. Yeah. So it's important. That point is very, very important. And a lot of these people, they visit their antenatal care now because everybody is listening to radios.
But that's what the research in the women the recent research in the statistics in I want it and the 85 or 95% of the women don't do that.
I want to be the one. Like that.
Okay, wait.
No, maybe I don't know you. If I don't know you, if I don't work with you, how can I say you are good?
Yeah, you
I've
can.
traveled for a long time. We don't lie. We always tell the truth. That's why we don't get along with people. Because I'm not going to say that Fatu Baji, because you think today is my first day with you. No.
Yeah.
Since the day one, you reach out to me. Many people reach out to me when Dr. Samate, when we are denying the commit.
Yeah.
I have never do interview with anybody because I am very busy person.
Yeah.
I don't have time. But you see why it's another time? I take 2 hours just to come here.
Yeah. Yeah.
Because I know for your topic will be very, very interesting.
Yeah.
So if I work with anybody, my first job didn't mean another thing that will let me follow you because say is providing things for people. Because say work with me. I just rather work with me. You work with me. So I cannot say some people I never have their name. So Gambian problem to reach out to Mbali or Mbali will reach out to you and say, oh Mbali, maybe you don't know us because we are not that popular, but we are doing great job too.
But you want a new program of our aim so that you guys can know. Yeah.
Very happy. This guy is very smart. What she is doing is fantastic job.
Yeah.
Get hard of her no time.
Yeah.
Because what I am going to refer people to her.
Yeah. What about better?
This maternity all those days can be avoided.
It can be avoided. It can be avoided.
Look at all those beautiful girls on my page who deserve to die like that. They are all full of life. One of the girls Abesiri, Biri kai ko imi to blood la abe kumbola kema ba video ka wo ba to nya ka kai ko yura ngade challenge. But the reality is she is scared. She know that Gambia ni sura ta blood la ibu ka survive. And she died 2 hours after that. But you can see the fear on that poor girl face.
Yeah.
She's a university student. She's trying everything to help her family. Afutu that you know pura emotion to me more school or jora.
Yes, sir.
And coming from all it's not like everybody had of Gambia Women's Life. No. Some people don't go to social network. So some people don't know nothing. So we also join hands together and do a lot of radio programs and door-to-door visit.
Yeah.
Why I say door-to-door visit, neither like phone. Yeta molia, yeta alikalo ya, ye fan karfala ya, fan tebota Women's Life, but I'm good midwife, tebota Mali Charity Foundation.
But a lot of grassroots advocacy, huh? A bit akumaya tabasha.
Those sensitization is very important because it's not like we sit on the radio.
Yeah.
But I always, try not to blame the victims.
Yeah.
Why I always try to avoid that. But right now we don't want anybody to run away from us.
Yeah.
We want them to trust us. We want them to know that we are here for them.
Which is important.
I learn a lot from them.
Yeah.
Trust me.
Yeah. I learn a lot. Yeah.
Oh my God. I important because in maybe long. Go for long. So let her continue because she has a lot of experience.
Yeah.
I think she's a wonderful and Hadi too. More I like to work with them. They're very wonderful people.
Yeah, thank you. Yeah, thank you so much.
Thank you.
A lot of people are trying to get hold of me, but as you can see, I'm not focusing that much now because my son is basically decided to distract me, and I've been here I think for about 2 hours now. So I think we've achieved our aim. So it was about to raise awareness, about to create avenues so that your work, your individual work can complement each other. So, Mbaling's group is here, Gambian Women's Lives Matter. Midwives and mothers, they are brilliant. So please do work together. If you have a woman, midwives and mother, Gambian Women's Lives Matter. Nalia most of you think they cannot afford a pregnant link. Imang domoro afford no nutritious food. Imang afford no wala imam pasi soto purukata lopitano to, reach out to Hadi Juice or number bijele. They can help with that. The same applies to the midwives and mothers. If you have somebody in your group that you think might need blood at some point, because Mbaling is very good at posting stuff like that. As Asafe knows, she can easily write on her on her Facebook and request or demand for blood. You know, so that is the way you work together. And like everybody else said, we have to support each other. You know, we cannot do it on our own. Seiture is there, very, you know, very efficient at raising funds. She's very good at raising funds. So if somebody is struggling with money, you could reach out to Seiture as well. So I'm really glad that, you know, the outreach has been done. I'm really glad that you use this platform to be able to discuss some of the things. It's an ongoing topic. It's going to be here. It's here to stay. And I hope that people who work with government are also listening to this program so that they can reach out to these groups and find ways of working together with them, because all of them are doing amazing work. There's so much more to do. A lot of sensitization needs to be done. But, you know, if you start fighting with these groups, you start fighting, name calling them, you know, it's not going to help. It's not going to help. So please do reach out to these groups. The government should be seen working with these groups. Don't call Mbaling Cham and say, I want you to speak to First Lady. First Lady can be part of this conversation if she's going to help, but not to bribe, not to give Mbaling some money so Mbaling can be quiet. That's not going to help. We want to work with First Lady because First Lady also have access to resources. She's got access to resources. So please do reach out to midwives and mothers, reach out to Gambian Women's Lives Matter, reach out to all these other small charities that are working to improve the lives of women. Okay, my son said be quiet. So thank you so much. I am so grateful. Maring abarakas bake Allah doko ngajele akumayata. For me, amam matante albe ibe politic juma party juma to nyindong be group juma to, as long as nga musol la nyanto ke nyato nga wake priority, you know, I am fine. I can work with any one of you. Like, it doesn't matter to me really the political party juma, as long as itela doko moment ka musol makwelem aninka musol nafa, you know, I think I would be able to work with you. So to all our viewers, thank you so much for joining. Until next time, have a good Saturday. Take care. Bye bye.